One.
Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, March 10th. We are joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpreter Mary Thiessen and Audrey Boursier from French Language Services Directorate are joining us. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having an issue with hearing, please email ecoinfo@yukon.ca. Premier Silver?
Thank you very much, Pat. Thanks, everybody, for joining us today. We're coming to you from the traditional territory of the Kwanlin Dun and the Ta'an-Quachin Council. Very happy to be here today with Mary and Dr. Hanley and Andre. Again, this week we have no active cases of COVID-19 in the territory. Great news. We wouldn't be in this position without the tremendous effort of Yukoners to stay safe and to protect each other. Again, thank you very much for all of your efforts. Practicing the Safe 6+1 are still the best things that you can do to protect our territory as we continue the vaccine rollout. So again, thank you. We are now in the second week of the general clinic here in Whitehorse, and we continue to hear positive feedback about how it is operating and helping people get immunized. Thanks to Team Fox and of course to the 2 mobile teams, Balto and Togo. Our mobile teams have been back in those communities again for the second shot, as well as for folks, if for whatever reason you missed your first shot, you can get your first shot at this time as well. I want everyone in the communities to know that there are plans in place to ensure that everybody receives their second shot, even if they just received their first shot just in the past few days. We have enough vaccines for everyone who wants one, and we will be sending staff and doses back to each community to deliver the second shot so that you are all fully protected. I strongly encourage everybody to get their shot. Check online at yukon.ca/thisisOurShot to book an appointment. At the end of Monday, we have 15,572 Yukoners that have received their first shot, and also 8,840 who have received their second shot. Yukon is leading the country in immunizations, and it's so great to see the numbers grow every single day. We are getting closer to our target of population immunity. I know Yukoners and businesses are eager to hear what will happen next. Now, our approach to managing the pandemic continues to be guided by the recommendations of Dr. Hanley and his team. We continue to follow the Path Forward plan, a phased approach to lifting COVID-19 restrictions in the territory. Last week, we provided an update to the plan that provides more details about our next steps. We have learned so much over the past year, a year filled with so many ups and downs, and so many unexpected developments. We could never have guessed that the arrival of a safe and effective vaccine would be ready here today and early here today in the brand new year. The updated plan better reflects our current situation, and most importantly, it lays out a clear plan forward for transitioning to the next phase of pandemic response. As Dr. Hanley has said, the vaccine is our pathway out of this pandemic. The rates of update is very promising, and we feel very comfortable announcing some changes that we can look forward to as spring approaches. The first update concerns the education of our grades 10 to 12 students here in Whitehorse. I've spoken with Dr. Hanley and with Minister McPhee and confirmed that these students will be able to return to full-time in-class learning next month. This will involve planning and organization in the coming weeks. Dr. Hanley and his team and educational officials will be working with principals, school councils of the 3 high schools in Whitehorse, as well as the Teachers Association, the Yukon Teachers Association, to ensure that these students can return to full-time learning as soon as it's safe to do so. And like I say, that will be the forecast right now is for next month. Dr. Hanley will have more to say about this and about some of the updates needed in the guidelines for schools in a moment. But this is exciting news. We're very pleased to be in a position to return these students to full-time in-class learning this school year. I want to thank Minister McPhee and her team at the Department of Education, as well as all of the teachers and staff at our schools across the territory for their absolute tremendous work throughout this pandemic. We have not seen the impact on our education system that other jurisdictions in Canada have, even though we have been affected drastically. And it really does speak to the wonderful team of people who are working every day to support students. And to all of you, thank you very, very much. The next change that we're going to be seeing is to allow us to increase our social bubbles. We know how eager people are to spend some time together and to reconnect after a long and difficult year. As the vaccination rate continues to increase, and that's really the most important thing right now that we're paying attention to, and the case count as well remaining low, we hope to be able to make adjustments to allow for larger gatherings in coming weeks. Students are set to enjoy spring break next week, and I know that Dr. Hanley and his team are definitely keeping an eye on that. I encourage all students and all families. I know the weather's getting nice and the sun's back. Please, we really need folks. We need to get over a couple more hurdles here, and we need folks to continue to following the Safe 6+1 over the break. God forbid that that we see increasing gatherings and having to be worried about those before it's time. So the longer spring days, and the increased daylight, as I mentioned, it's absolutely good news. It's good news for our mental health. It's good news all around. And the opportunity to spend more time with friends and family, we're getting close there as well. And so, again, good news coming on increasing our bubble sizes. I know a lot of Yukoners have friends and families in other parts of the country and are looking forward to the opportunity to spending more time with them this year. I heard Dr. Hanley speak this week, and we've had conversations as well about his hopes for lifting travel restrictions in late spring, early summer. This is very encouraging. I've also been talking to fellow premiers about travel bubbles. We all recognize the importance of individuals being able to visit with friends and family, especially as people are immunized and it is safer to do so. At the same time, we know up here in the territories that mandatory self-isolation has been absolutely critical in keeping us healthy and safe. Together with the Northwest Territories, the North is leading the country in vaccinations. The recent approval of the AstraZeneca and Johnson & Johnson vaccines is very great news for Southern Canadians. If the current trends continue, I'm hopeful that we will be able to look at travel bubbles in May and in June. What we are able to adjust in the coming weeks and months will depend. They will be depending upon things continuing upon the same trajectory that we've been seeing recently, with case counts going down across the country and vaccination rates increasing both here in the territory and in our neighboring jurisdictions. We also need a better understanding of the impact of the vaccine on the new virus variants. That's still a concern, but we are cautiously optimistic about what we are seeing. I will leave it to Dr. Hanley to elaborate in more detail on conversations that he's been having with how the medical community is thinking about the current situation. But for now, we're doing what we've been doing for a year now. As soon as we have information to share, we're giving that information. We're giving time for people to adjust and to react. And this is really good news for Yukon. But again, we really need to keep up our diligence with the Safe 6+1, and we really need to get people vaccinated. For now, I'm very happy to share this update with Yukoners, and I want to reassure you that we will let you know that we will continue to share information as soon as we have it possible to share. When we are ready to reintroduce travel bubbles, for example, we will tell you in advance so that you can start making plans. In the meantime, again, I know I sound like a broken record, please get vaccinated. Please continue to practice the Safe 6+1 and make sure that you can talk with family, people, and friends and business associates about hesitancy and direct them to the most up-to-date information on yukon.ca. We're seeing an end of COVID and a brighter future on the horizon, and the path forward has still many unknowns, but we've learned so much in so little time. When I say an end to COVID, we know that we're going to be dealing with COVID for an awful long time, but we're seeing great trends moving forward. One thing that we know for certain is that we will get through this if we all continue to do what Yukoners do, and that is to support one another and to work together with each other. So please, continue being you, Yukoners. Continue to check in on each other. Continue to be patient and keep up the good work. Be excellent to each other. Thank you very much. Masicho.
Thank you, Premier Silver. Dr. Hanley?
Thank you. Thank you, Premier Silver. And good morning. Bonjour, bon matin. It was just over a year ago, March 7th, 2020, that we announced the famous and heartbreaking news of the cancellation of the Arctic Winter Games. On that day, COVID-19 hit us like an emotional tsunami. It seems hard to believe that only a year has passed since COVID-19 so disrupted our lives in Yukon. When we initially heard of the world's first confirmed case of COVID-19, it seemed too far away to most to pay much attention. In the world of public health, we were quietly putting together initial guidelines and updating our providers regularly on what we were seeing and hearing. Still, when COVID-19 hit Canada, it did not take long before it took over almost all of our lives. Even we did not think that the world would shut down before our very eyes. In those early days, there were still so many unknowns about the virus. None of us was exactly sure of what we were dealing with yet. Our nerves were high, but we pushed on and prepared ourselves to face what we thought might come. When thrown this challenge, it's quite incredible to see how quickly people adapted to all the changes and hardships, making the best of a situation that none of us invited. People found new creative pursuits, found different ways to make a living, found ways to help one another, and found new ways to connect with loved ones from a distance. Many have struggled, and many have faced despair. But overall, we adapted and we persevered during a time that was tinged by fear. As the past 12 months have gone by, I have witnessed the remarkable strength, kindness, and generosity demonstrated by Yukoners. We have banded together in a time of uncertainty, adapting to ongoing changes and showing a tremendous amount of resilience. And we have done so together as a territory. Our goal throughout this pandemic has been to contain cases to a minimum in order to prevent large outbreaks and to protect those most vulnerable to the disease. Looking at this past year, I think we fared quite well and accomplished what we set out to do. Let's continue to build on our current momentum and take the steps we need to return to move forward to a new post-pandemic Yukon that incorporates all the lessons learned from living through this last year. Our campaign, the vaccine campaign, continues in full swing, and as the Premier said, by the end of Monday, we'd administered over 15,500 first doses in Yukon. We're wrapping up second visits to all communities, which will be complete as of this Saturday. Although our turnout has been admirable, there are still many who are eligible for immunization, and we want to make sure that everyone has a chance to receive the vaccination if they wish. With that said, we are in the midst of planning third visits with smaller teams working with the health centres in the communities to ensure everyone who wants to get their vaccine can do so. So far, as of Monday's end, as the Premier said, we have administered almost 9,000 second doses. We're moving ever closer to reaching our goal of a substantial number of Yukoners being immunized. This would not be the case if it were not for the outpouring of enthusiasm across Yukon. For those of you who have been there, as I have, I'm sure you would agree that it is awe-inspiring, not just to see the turnout day after day, but to be part of this movement. Those who are still thinking about getting immunized, I want to provide assurance that both your first dose and your second dose are waiting for you when you're ready. Just last Friday afternoon, the government officially released the next steps document as the path forward. As the Premier mentioned, our revised path forward is essentially a roadmap to help Yukoners understand how restrictions will be eased over the coming months. This document presents the rationale on how we intend to return to living our lives as fully as we can while balancing the risk of the virus. With an overall goal of enhancing Yukoners' well-being, our plan is to lift restrictions within acceptable risk levels and evaluate success as we go. So how do we move forward? The Path Forward's two-step approach will help us lead to better days. First, we need to strengthen our foundation of COVID protection. A solid and reinforced protection against COVID introduction will allow us to then go to step 2, which is to gradually reduce restrictions within the territory. Reinforcing the foundation means that we must, for now, continue to follow existing health measures while the vaccine campaign is underway. With vaccines gradually adding to our existing protections from public health measures, the risk of transmission from any future introduced cases drops. Every additional person vaccinated helps to prevent spread from any case that does make its way in. To review what public health measures need to stay in place, they are carefully following the guidance for self-isolation when required, getting tested when symptoms occur, staying home and away from others when sick, and, of course, getting immunized. In this current phase, we are taking care to do those things that keep us all safe and get vaccinated. These are the ways we set the foundation upon which we can slowly open things up. Having reinforced the foundation, we can then gradually reduce restrictions. The enhanced protection, which is the focus of step 1, in other words, will allow us to reduce some of the restrictions that have constrained our day-to-day lives. Step 2 marks our transition into a new phase of our recovery. While there is not a definitive date of when this phase will occur, we have worked on establishing some benchmarks that we will need to make this transition. Vaccination, of course, is a key part of enabling this transition, and our aim remains to work towards as high an uptake of vaccine as we can get. Our goal remains 75% of the adult population, and the closer we can get to that goal, the more confident we can be in our measures. We are more than halfway there, and it will take time and the combined efforts of many of us to continue towards our goal. I guess I've been talking too much lately. The list of possible measures is laid out in the tables available in the Path Forward document. For the coming spring and summer, we have identified a number of steps where we will concentrate some of our initial plans. As the Premier announced, we are planning for a springtime resumption of full-day in-class learning for grades 10 to 12. Although kids and teachers have adapted well and made the most of a difficult year, I have continued to hear from parents that kids are challenged with the half-days. We know that students do better overall in a face-to-face learning environment, and now that routines and processes are well rehearsed, and the worldwide experience of schooling in the face of COVID has grown substantially, I feel confident that we can do this safely. Of course, should we face significant outbreaks in schools associated with a surge of COVID activity, we will continue to have contingencies for online learning in place. In addition, we're working with Yukon University to support a return to face-to-face learning for September 2021. Second, we will develop guidelines pertaining to summer camps and outdoor sports. I understand that many of you are missing the sun-filled days on the outfield, and along with the initiatives already shown by Yukon sports organizations, I hope to encourage more participation in outdoor activities such as softball and soccer this summer. Our focus will also shift to revising our current recommendations regarding social bubbles and gathering sizes. These decisions will be guided by our rate of vaccination in the territory in the weeks ahead. The faster we can achieve a high level of immunity, the more likely we will be able to ramp up our reduction of current restrictions, such as how many people you can see without needing to take precautionary measures. And finally, I know that globetrotters, that Yukoners tend to be, many have begun to get a bit stir-crazy. As much as we all love Yukon, we miss seeing family and visiting the outside world from time to time. Many of us have friends and family outside, and many are aching to sniff the ocean air or tuck into the latest cuisine with loved ones. At the same time, there are those from outside our borders who are longing to come up and visit. So, with that said, we are once again exploring the possibility of opening up to other jurisdictions by modifying or removing quarantine requirements in the coming months. Last year's BC bubble was a great success, and we kept it going as long as we could, until the risk of importing cases from BC became too high to tolerate. As an interim measure, before we can relax restrictions entirely, similar arrangements should once more be possible, should COVID activity decline to acceptable levels in combination with vaccinated populations. Wherever we go in the weeks to come, we will need, as always, to take time to get there. Opening the doors widely and pretending the pandemic is over would be foolhardy when variants are on the rise and COVID activity is still high in much of the country. But moderate, incremental measures should become more and more feasible with time, with declining COVID activity and with increasing vaccine uptake around the country and eventually around the world. Even when we achieve the goal of vaccinating a majority of our population, a number of people will remain at risk. Children and youths are months at least away from getting vaccine, and we know that some people will not come forward. But we don't abandon those who are not old enough or not accepting of vaccine. We will do best when our measures are based on the overall public good and how protected we are as a community, rather than pursuing measures based on individual benefit. As we have said from the beginning, we are all in this together. I know that as we receive our vaccines, the day-to-day threat of COVID-19 may not feel as imminent as it does in other parts of the country. However, this would not be the case had we been more relaxed with our measures. If our current public health measures were reduced at this point, where nearly half our eligible population is still not vaccinated, we would still be putting ourselves at substantial risk. Eventually, we hope that vaccine will do most of the heavy lifting against our fight against COVID-19. However, until we can be sure of that, it is necessary that measures remain in place, and Yukoners need to seek vaccination. In our path forward, we will continue to track closely COVID activity in Canada, hold conversations with local and national leaders, and work on developing an approach to enable a gradual return, ever wiser, to the things that we always used to take for granted. We have so much to look forward to in the coming months. And that's all for my update. Thank you. Remember to take care of each other. Remember the safe 6+1. Stay well. Merci. Thank you.
Thank you. We'll go now to our phone lines, and we'll begin with Luke, CKRW.
Hi, I have a question for Dr. Hanley. I saw that the state of Alaska was beginning to vaccinate the general population, and they're going as young as people 16 years of age. I'm curious, with students returning to full-time classes here in Yukon, if there would be a consideration of getting people that young in Yukon vaccinated as well.
Yeah, thank you for that question. So Alaska is using a combination of products for vaccine. As you know, we have the single product, at least so far, Moderna. And Moderna is only approved for 18 years and up. So we don't have the approval for the 16 and 17-year-olds with Moderna. Whereas in Alaska, of course, they're using the Pfizer product, which does have the 16 and up approval. So that is a gap. We recognize that, and we're anxiously awaiting information on the phase 3 additional trials that Moderna is undertaking with the 12 to 17 age group, and sort of looking for timelines around that. The most efficient way to address our young people, their need for vaccine, would be to do that with the Moderna product if the approval process works in a timely way. Right now, the priority is definitely the 18 plus. Of course, as I said in my notes, we're very aware of the needs for children and youth. That is a secondary priority, to be frank. But it is important, of course, eventually to cover our children and youth. So more to come as we get more information on new approvals for Moderna based on their trials and other products in the pipeline.
Thank you. Luke, do you have another question?
I do not. Thank you.
Thank you. We'll move to John, CKRW.
Hi. So this goes to Dr. Hanley or the Premier, whoever's best to answer it. Now that Canada's approved the Johnson & Johnson shot, and the data has come out saying that it's good for more rural communities because of the transportability due to the lack of refrigeration that's needed, and it's a single dose. Is the government of Yukon considering getting the Johnson & Johnson shot up north?
Yeah, thanks. It's a great question, and yes, we have flagged interest in this vaccine because, as you say, I mean, it has a number of potential advantages. One is it is a one-dose vaccination. Secondly, it is a fridge-stable vaccine, so much more amenable to transporting around to remote populations. I think it would be a very good fit for some of our rotational workers, for instance, those who come in and out of territory to work. So it's definitely under consideration. What we don't have yet is an allocation schedule for Johnson & Johnson, and that's from the company. There's as yet no date for when supplies will be available. So I would say it's definitely an option we're interested in. It's not a final decision. I think ultimately it will be an advantage for us to have more than one product. But on the other hand, if the timing works better for Moderna, then in terms of covering these other populations, then that may become our first choice.
Thank you. John, do you have a second question?
I did, but I no longer do. Thank you very much.
Okay, thank you. We'll move now to Haley, Yukon News.
Hi, thank you. Questions I have are related to travel bubbles. I mean, when we refer to travel bubbles, is that kind of inferred that it would be bubbles that have existed before, maybe with NWT or BC, or are we looking at potentially a bigger bubble? Just wanted that clarified.
Yeah, I think I mean, obviously, we have experience from the bubbles that we had, the arrangements, at least that we had for initially with the Northern Territories, what was a reciprocal bubble, which then became a one-way bubble, as you might say, and with BC, it was always a one-way arrangement because BC, of course, has always had open borders. So I think there are just a number of possibilities, and again, it just depends on what's happening with COVID activity and how one connects to the other. So for instance, if we were to have a northern bubble, would we be able to sustain that from the other territories' point of view if we then had an opening arrangement with BC? And what about other? I know that last year there was, I would say, intense interest in also having arrangements with Alberta, for example. And so I think, in my mind, it's all on the table. It depends on how they connect with one another on many of the I guess other kind of logistical considerations, but from a public health point of view, in terms of making lives easier for Yukoners, if we're comfortable with the risk, the importation risk, then I would be supportive of either similar arrangements to what we had last year, or other arrangements with other jurisdictions.
Premier Silver?
Yeah, I don't have too much to add from that, Haley, other than we won't take offense that you're not in the room today. You normally are. But I think, too, like it'll be different than last year because there's different variables. We have a vaccine this time around, and Dr. Hanley and his team are watching the epidemiology, also the concerns of the variants. But, yeah, it's plural. We're looking at doing our best to have less restrictions, but again, doing it the safest way possible.
Thank you. Haley, do you have another question?
I do, yeah. My second question, Luke referred to Alaska opening up, being the first U.S. state to open up vaccinations to its whole population. I'm curious, it's probably a long way off, but is the government looking for some opportunity that the border with Alaska may open before Canada opens its international border with the States? Is there consideration that might be something taking place in the Yukon?
Great question. Very good question. And Dr. Hanley and I were talking about that just this week as well. It's definitely a conversation for the next Council of the Federation, and we brought it up in the past. A lot has changed in the last several months. We've had a lot of focus at the Council of the Federation table at the Canadian health transfer. I'm very eager to get back to the conversation of, okay, federal government, what are we doing as far as different countries? What is the approach? Are you looking at, Alaska is, a part of the lower 48, but it isn't part of the lower 48. So it's really in their hands. I could feel Minister Stryker, right now, thinking about, what these ramifications would have for our internal borders as well, because it's kind of a hand-in-glove conversation. If the federal government changes their perspective from an international border situation, then we'll have to consider what we do with our borders as well, and for the people moving around. But it is definitely a conversation that we've been putting forward at the Council of Federation, and we'll continue that now that spring is turning into summer. Yeah.
Yeah, the only thing I'd add to that is, although we are very close as we are with other northern jurisdictions, but we have a close relationship with Alaska, with my counterpart, Dr. Zink, in Alaska. So. But it has to be recognized that they still have a long way to go. They are, literally in that battle between COVID cases and the potential for another surge and vaccines. And they have a fabulous vaccine uptake, as you know, the best in the country, in the U.S. But they do have some challenges ahead of us. But yeah, this is definitely a conversation that we are following and interested in.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, hello. Thank you. First question is either for Dr. Hanley or the Premier. Well, this is great news, the changes that are coming. It marks pretty much an about-face for what you've been saying for a number of weeks. So I was wondering if either one of you could expand on how this decision-making process happened and such a great turnaround.
I'm trying to. Well, thanks for the question. I'm trying to figure out where that about face happened. I think what I know that what we've said is that we will continue to follow COVID activity. We have been replanning this path forward for a number of weeks, and we continue. I would say my phrase of the week is cautiously hopeful that we're not over this yet. We do have still a significant importation risk of cases. We still have high variant activity and increasing variant activity in the country. But at the same time, we are in this era of rapidly increasing vaccination, which gives us a comfort level to start making some predictions. We know that people want to have some idea, of timelines, and I think it's an effort to at least portray what we are thinking of, what we think we can do safely within a reasonable time frame. So I think it's really just putting a little bit more flesh on a plan and a direction that we've been working on for months.
Premier Silver?
Yeah, I think I share Dr. Hanley's a little bit of I don't know. I don't think this is an about face at all. Even 2 weeks ago at our announcement, quoting verbatim from Dr. Hanley, we'll know more in 2 weeks. And, that's on variants and how variants are spreading and clustering in all parts of the world, but also on vaccination rates. So we've been very clear that these are the things that we're looking at. We've been very clear in the pathway forward about what things can change based upon these things. And I'm perplexed that this might look to you as a change in direction, but to us it's been this steady, slow and steady process the whole way around.
Next question, Tim.
Yes, just regarding the rates for the regions that was released on Facebook the other day. Any explanation for why a couple of the regions are probably below expectation as far as their uptake of the virus? I'm thinking particularly the central region, which your figures show is about 44%.
I think I'm going to hand this off to Dr. Hanley because I think he answered it very well in media this week, actually.
Yeah, so again, and I really, I think I said yesterday I had not really paid much attention to those numbers, even though I know there was an intense desire to view them publicly, and I will be much more interested in how things are looking after this current round, because you're really comparing some communities that haven't had their second round with those who have already had 2 rounds, for one thing, and we know, and we've had that experience even so far this week, that many people who were not ready with the first round are coming forward for their first dose on the second round of the community visits. The other thing is that there are just so many different variables, and how they play out in very small communities. You can have a few people coming forward or not that can make a substantial difference to percentages. So this is why we have always been very leery. I would say that the Premier has, and I have as well, of kind of pitting one community as another against another. This is not a competition, but it's an overall aim to work together to get to goals. We have, but there can be factors such as how is transport arranged to enable people to get to the immunization facility. What's the influence of social media or influencers in different communities, either one way or the other? Where are people getting their information from? What's the timing like? Are there have been examples where it just happened that there were a cluster of people that were not present in the community at the time, and so there are just so many different variables. But we are, as these as these visits are happening right now, and as the third visits are being arranged, we are also in literally daily conversations, multiple conversations through my team and through other government departments as well, community services, and other departments through communications in liaising with community leaders, in liaising with people in the communities, in understanding some of these factors that are particular to one community, and in addressing those factors, and providing that information. The community engagement process is something that I have emphasized from the very beginning of this pandemic, that we do this by we're understanding where community concerns are coming from and addressing those as we go. So this is a work in progress. The community visits have been overall a great success, and we are continuing to see increasing uptake around all of the communities.
Thank you. We'll move now to Claudiane, Radio-Canada.
Oui, beaucoup à traduire. Je vais vous poser la question, Dr. Hanley, d'abord pour ce qui est de l'éducation des classes à temps plein. Qu'est-ce qui fait qu'à ce moment-ci, vous vous sentez suffisamment à l'aise pour permettre les classes à temps plein, considérant que ce sont des jeunes qui ne seront pas vaccinés?
The changes in education, what makes you feel comfortable at this point to authorize the school for grade 10 to 11 to go back into their classroom next month?
Oui, merci pour la question. C'est comme j'ai expliqué en anglais, d'abord, c'est une expérience, c'était une expérience difficile, on sait ça pour les étudiants, même qu'il y a beaucoup de succès, même qu'ils ont bien adapté à le programme de demi-temps pour les années 10 jusqu'au 12. On reconnaît que l'état, la situation, le meilleur, c'est d'être plein temps à l'école, face à face. Donc, c'est pour reconnaître qu'on continue dans un bon état, et on a aussi un bon plus et plus d'expérience globale avec le succès des écoles, même dans les situations avec pleine activité COVID. Pour la plupart, les écoles vont bien, et donc on peut prendre l'expérience, la pratique globale des écoles dans les situations de COVID, et en considérant qu'on continue dans un bon état avec très peu de cas, qu'on peut maintenant suivre les tout ce qu'il faut de point de vue de sécurité et sanitation avec tous les étudiants dans les écoles. Donc, on a parlé avec le département, avec les principales, les administrateurs des écoles, pour voir les possibilités. Et donc, je pense que c'est une bonne opportunité avant la fin d'année pour avoir au moins 2 mois et 2 mois et demi avec plein temps dans les écoles. Et finalement, c'est pour le bien-être des étudiants.
Avez-vous une autre question, Claudiane?
Oui, donc dans la même veine, quels seront les facteurs décisionnels pour rouvrir les frontières? Qu'est-ce qui est considéré? Qu'est-ce qui sera les facteurs que vous allez prendre en considération pour peut-être ouvrir les frontières avec les autres territoires, ou encore la Colombie-Britannique, ou encore l'Alaska?
So, what are the factors that you will consider when you will look into opening up borders, either with other provinces or with other territories? What are you going to consider to illuminate your decision?
Oui. D'abord, ça dépend de l'activité de virus, de COVID dans les provinces ou même l'État. Mais est-ce que c'est stable? Est-ce que c'est plat? Le courbe. Et donc ça, parce que ça influence la risque d'importation. Si un Yukonais va, par exemple, en Colombie-Britannique, qu'est-ce qu'il y a le risque pour attraper COVID et revenir avec pour transmettre. Donc, on a ça, l'activité COVID. On a aussi, le plus on est vacciné, le plus sûr on peut avoir des mesures d'ouvrir et d'enlever le besoin pour la quarantaine. Et aussi, est-ce que les gens sont plus ou moins respectent, est-ce qu'on suit les mesures qu'on a en place pour suivre les mesures normales, les Safe Six, par exemple. Donc, est-ce qu'on a une adhérence continuelle pour avoir confiance dans la population? Par exemple, si on continue d'avoir une bonne adhérence aux mesures, les distances physiques, on peut empêcher la transmission de COVID, même si on a des importations, on a plus de confiance. Donc, c'est une combinaison d'activités COVID, d'adhérence des mesures publiques avec le taux de vaccination et finalement la volonté de tout pour avoir cette potentiel d'avoir ces ouvertures.
Merci. We'll move now to Philippe, CBC Yukon.
Yes, thank you. I wonder how long we will see the mobile teams continuing their work in communities. Do we know yet how long that campaign will last?
Sure, I'll take a stab at that, Philippe. So right now there is planning for a third visit. And this is it's almost like a transition, you could say, for the visits. So these are not going to be the big teams doing the third visits, because by and large we're talking about smaller numbers of people, of course, that will need either their second dose or potentially a first dose. So it's almost like this. I would say incremental arrangements. Really, the aim is a handover to the community health centers. We, of course, the nurses there are trained vaccinators who give immunizations all the time. It's really been the thrust of these initial visits, of course, have been dealing with large numbers and dealing with the particularities of the Moderna vaccine. But now that we're much more familiar with what it takes to move Moderna around, and we're dealing with diminishing groups or numbers of people, it becomes much easier to do that planning. So, for example, it might be do a third visit and leave a couple of vials of Moderna behind to take care of those first doses need for second dose, and so on. So I think this is really what we're seeing as a progressive handover to the community health centers for ongoing vaccination needs.
Premier Silver?
I will add, but not to that. I will just add, Philippe, as well, that tomorrow is the first day for walk-ins in the clinic here in Whitehorse as well. So also another important milestone when it comes to getting that overall population vaccinated. So,
thank you, Philippe. Do you have a second question?
No, thank you.
Thank you. And then we move to Laurie at Aurore Boréale.
Oui, ma question est sur le retour en classe à temps plein. Est-ce qu'il y a des craintes en lien avec la semaine de relâche et le retour en classe à temps plein? Vous n'avez pas peur que cette combinaison-là cause une hausse des cas à ce moment-là?
So the question is about return to classrooms for higher grades. Given that we're going into spring break, aren't you afraid that spring break might be derailing the plans to have students back in classrooms?
Si tout le monde fait la bonne chose, donc c'est une très bonne question et c'est un rappel pour tout le monde que tout qu'on prévoit dépend de la stabilité de la situation ici et en plus de la taux de vaccination en augmentation. Donc, oui, c'est un risque, mais il y a toujours un risque. Donc, c'est toujours une balance de risque qu'on prend. J'ai confiance que les gens sont, pour nous, pour notre population, on comprend bien les conséquences de voyage si on a fait des plans pour voyage. Pour un rappel que le voyage non essentiel, ce n'est pas conseillé à ce moment dans le pays. Et mais pour ceux qui continuent de faire des plans de voyage, les besoins de quarantaine, la loi en fait, ça continue et c'est pour tout le monde de suivre les mesures déjà en place pour protéger la transmission du virus. Donc, même si quelqu'un arrive avec un virus tel que COVID ou variant, que si on suit les mesures déjà en place, ça arrête la transmission du virus. Donc, bref, si tout le monde fait les bonnes mesures et suivent les bonnes mesures, le risque, c'est minimisé.
Avez-vous une autre question, Laurie?
Oui, je voulais savoir à quoi on pouvait s'attendre d'un déconfinement dans le domaine des sports extérieurs.
So could you please tell us a bit more what we could hope or expect if outdoor sports are more permitted than what they are right now?
Oui, il y a encore des détails, bien sûr. On va faire des guides, la planification, mais un exemple, c'est l'organisation de softball qui ont déjà proposé des mesures pour recommencer les activités de softball selon les mesures déjà en place pour les sports d'hiver. Donc, si on voit tout qu'on a écrit et publié sur les guides, les mesures pour les sports d'hiver, c'est déjà la base pour contempler les sports dehors de l'été.
Thank you. I'd like to thank everyone for their time today and advise that there will be no COVID-19 update next week. We will, however, continue to share information as necessary, including any information on public health issues through regular mediums. The next COVID-19 update will take place on Wednesday, March 24th at 10:30 a.m. Again, Wednesday, March 24th at 10:30 a.m.